Coming up next on Primary Care, we head to Flint, Michigan to speak with pediatrician Dr. Larry Reynolds about the Flint Water Crisis.
Children's diet, the diet was predominantly formula mixed with lead-laced water, while the officials told us everything was safe.
Hello, and welcome to Primary Care. I'm your host, Dr. Lonnie Joe. By now, most of the country has heard of the Flint Water Crisis, where for nearly 2 years, Flint, Michigan residents drank water contaminated with lead, a toxin that causes irreversible damage to the body. Flint children were found to have double, and in some cases triple, the amount of lead in their bodies. Nearly 40% of Flint's children live below the poverty level in a city where the population is over 60% African American, leading some to believe that the water contamination is much more than a crisis, but the poisoning of a city. Joining me today to talk about this crisis is Dr. Lawrence Reynolds. Dr. Reynolds is a pediatrician and president of the Mott Children's Health Center here in Flint, Michigan. His compassion for children and commitment to the health of this city has put him on the front line of this crisis. Dr. Reynolds, thank you for joining us today on the show.
Thank you, Doctor.
Before we get started, I want to read a statement from a quote from Dr. Mona Hannah Atisha. She's the pediatrician who helped reveal this crisis here in Flint concerning the lead levels in children. She says, and I'm quoting from her, "If you were to put anything in a population to keep them down, it's lead. And it doesn't just keep them down for a month, a year, it keeps them down for decades and generations. Lead should never be in the body of a child." Does that quote adequately identify this crisis that has occurred here in Flint?
Most definitely. Let me expand that. Lead is not good for any living thing, including your dog or cat. Lead is a heavy metal that replaces calcium, which is a normal, healthy mineral that comes into our bodies that's involved in so many levels of function. On an intracellular level, the little organelles that generate energy, on a cellular level, on neurotransmission, how the brain sends signals, how parts of the brain develop. So it's devastating. And here's the challenge. What critics of the work will say is, well, prove that something happened. And the damage does not become manifest until over the decades when we as developing humans have developmental challenges.
It's not a knee-jerk response.
That's right. That's right. So these things will become manifest. And so here we have a population in Flint that already has risk factors that present obstacles, and then you have one more known, preventable neurotoxin that was added to this list of risk factors that tips the scale to the negative side further.
Why are children more susceptible to lead poisoning than older populations?
Well, children's brains are developing at a rapid rate, especially between birth and 5 years of age. The brain doesn't finish developing until we're in our mid-20s, but at that 0 to 5 years of age, the brain is developing, it's developing connections, it's increasing in size, and lead affects all those functions. So as the brain develops, part of brain development is as the brain is getting wired, that wiring is determined by how it's fired, by experience. And we can discuss that because that's a whole nother remedy that we need to discuss.
So basically, we have a toxin.
Yes.
That has been planted like a poison pill.
Yes.
That does damage sometime down the road. Now we're wondering why 10, 12, 15 years later, a teenager or a young adult is experiencing crises, health and otherwise. We can actually point back to ingestion of lead and lead levels that are too high during the pediatric years as a cause of that.
That's right. There's immediate damage, And then because lead is stored in the bone, 90% of the lead is stored in the bone, it leaches out, so there's a continual exposure from that past exposure. And so the damage can be ongoing.
What is Mott's Children's Center doing in response to this? What has been the involvement? We know you've had lots of involvement. Help our viewers understand the position that Mott's Children's Center has taken on this.
Well, our key right now is identifying those children, monitoring their development, making sure that the lead exposure has been reduced or eliminated, and then monitoring their development during the various phases, infancy, preschool, and looking for opportunities to mitigate that damage. And then working as part of a coalition, because as you know, only 20% of health outcomes are determined by what happens in a medical office. There are broader things, environmental, social, economic, governmental policy, that have a more direct and lasting impact. So I'm talking about structural issues. It can be structural racism, it can be environmental injustice. So that's why it's so important that we participate in a broader coalition.
Exactly, so 20% is not passing in anybody's academic institution.
That's right.
Last time I looked. Okay, so we're actually looking at a system that prides itself on what it does.
Yes.
But in actuality fails.
That's
in
right.
the long term.
That's right.
Not to mention that the lead issue is probably just the tip of the spear in terms of all the other things that you mentioned, including social, academic, political. Where is the call to action for that kind of camaraderie to exist to address a problem like lead poisoning?
Well, first we have to appeal to professionals and people in positions of power to listen to residents. When a resident says, I have an issue, don't just write it off because it's not presented in a way that makes you feel comfortable or not as articulate as your peers. So we have to learn to listen. Secondly, we have to monitor what's going on, and that was one of the biggest failures in this ongoing Flint disaster. Failure to maintain infrastructure, monitor the integrity of that infrastructure, to monitor water quality, to respond appropriately, and to listen to citizen and resident complaints.
Not only did the system break down, but the community followed.
Oh yes. Well, we were under, and I'll get into the political sphere, we were under an emergency manager, and I'm sure many Detroiters are familiar with that, as well as people in Pontiac, Saginaw, Benton Harbor.
Absolutely.
The mayor had no power or authority. The elected city council had no power or authority. An emergency manager was sent in, and his or her main function, because we had a series of 4 or 5, depending on the title, their main function was to cut the budget, to balance the budget, cut essential city services, and then they presided over a city government in functions in which most of them, and especially in Flint, had no expertise. How to handle a public health emergency, how to respond to issues of public health and water quality. It was a disaster.
Dr. Reynolds, we're going to get back to the political side of this, but more along the medical lines. How are children and teenagers affected mentally from abnormal levels of lead in their system?
All right, I'm glad you asked that way. When we talk about poisoning, you know, people expect to see folks laid out in a hospital bed, or they're looking for an arm growing out of somebody's head. But these are problems of how the brain functions, how it processes information, problems of mood regulation, going from anger to depression, problems of memory, attention, control of impulses, and just learning basic things like complex problem solving that you would find in math, reading comprehension. So all these things carry and they accumulate in a population across their life course. Now, I can't say because a child had a certain lead level, this will be the list of problems. What I can say that in a population, continued exposure to lead, even low-level lead exposure shifts the curve to the left. So in a normal bell-shaped curve, you have the 5% so-called geniuses at one end and the 5% of below normal IQ at the other end. Well, lead exposure, like alcohol and other things, shifts the curve to the left, so you have more children who will need special ed services and interventions. So that can, over the course of a 3-year period, studies have shown that can cost as much as $38,000 more for education. So then you have the issues of educational attainment, dropping out of high school. With the mood regulation problems, it puts you in harm's way with the law enforcement and criminal justice system. And many people are not aware that Freddie Gray in Baltimore was a lead-exposed child at a higher level. And once again, the scale is tipped toward negative outcomes. It places a population in an at-risk situation, and the impact is devastating for a community. So it's a community health issue with manifestations in individuals.
And a lot of finger pointing and blame laying at the feet of the inappropriate people. It's the family's fault that Freddie Gray had his problems, not necessarily looking at the history, in particularly the medical history that came out very late in that whole discussion. Speaking of families, how is this, the kids can't necessarily speak for themselves, but how is this affecting the parents of Flint, of these lead-poisoned children, the grandparents, the people who actually are responsible for those children? It's got to be devastating to them also.
It's most devastating. Consider a mother who mixed formula with tap water for her infant for the first 6 months and even as long as 12 months of that child's life. So children's diet, the diet was predominantly formula mixed with lead-laced water, while the officials told us everything was safe. So imagine how a parent or a grandparent feels. And then there's the issue of stress. Our children vibe off of what they see us. They are experts in reading our moods.
So mom's depressed because she finally realizes that, boy, I was part of the poisoning sequence. The guilt comes along, the depression comes along.
Yes.
She's probably not in the medical system properly either. Sounds like a domino effect.
Yes, and then the worry, because every time your child does something, we as parents will say, was that because of what I did? And so it just goes on, and we're not aware of the effect we're having on our children because they see us watching the news, they hear us talking, and they have to interpret these things in their own way if we're not paying attention to what we say and what we do, and we can focus our attention to our children and say, well, this is why I am worried. This is why I cry sometimes. And then the other challenge is, what can we do? Lead damage is irreversible. Once the damage is done, it's irreversible. However, because of the plasticity of the brain, as long as we provide adequate stimulation, nurturing experiences, that can mitigate or reduce the damage of exposure to toxins like lead.
How about that? Not to mention, we were taught in medical school the most important things to do is to change the environment, remove the toxin, get rid of the lead. Good. We're going to toss to another break. We'll be right back with more primary care and Dr. Lawrence Reynolds.
There's no antidote for lead. So we are building this model public health program. Donating to Flint Kids will help us support access to nutrition, universal preschool, access to a pediatrician. If there was ever a time to invest in our children, it is now.
Welcome back. The Flint Water Crisis has many parents feeling uncertain about their own health and the health of their children. Here's how it's affected the life of one family.
I'm overwhelmed. I'm constantly at doctors. I live at doctor's appointments. I see a counselor. I'm depressed. And I don't want my kids to grow up and, be all messed up from this. When I gave birth to my daughter, she ended up having lead in her system. That's when really I started noticing things, and then it all came out that the water had lead in it. I had them all tested. They all were tested with lead in their system. As a result in that, he has major behavior problems. He takes medicine. They all were poisoned. The school's calling me. They know about the water. They know my child's on medication. They know it's an ongoing, medical problem. I try to work with them. I changed his medicine hundreds and hundreds of times. I don't know what else to do besides what I'm doing now is keeping them at the doctors, keep getting them tested, keep them vitamined up, make sure that my kids are healthy. They see a therapist. My 2 older ones do right now. So they understand and everything and their behavior problems, so we can work with them because they do have behavioral problems.
And the worst thing is that me and my brother Vance drink a lot of water.
Yeah, and before they knew, they were drinking lots of water out the sink before we knew. That really crushed me. I feel like we're paying for poison, and we pay the most out of anywhere in Michigan, the most money for water, and that's really ridiculous, and we're paying for poison. I'm poisoning my kids. Every time I give them money for our water, I feel like I'm poisoning my kids. That really crushes me. It crushes me bad because I feel like I have to pay it. I don't want my water shut off, but we can't drink it. We can't cook with it. We can't do nothing with it. We can't bathe in it. And I want everybody to know that, it is hard because when you don't have the money or the water or that, what are you supposed to do? That's how we live.
We live in a life that's full of lead.
We have a public health crisis in Flint. 10,000 kids have been exposed to high levels of lead.
These kids did nothing wrong, and we are going to flip the story and give hope to our children.
This is about coming together as a community. We're in it until people can take a drink from the tap and not worry about what the water quality is. We have to make sure that this never happens again. And I think removing the risk, which are the lead pipes, would go a long way to helping that.
There's no antidote for lead. So we are building this model public health program. Donating to Flint Kids will help us support access to nutrition, universal preschool, access to a pediatrician. These are the things that our kids need now.
To have 2 strong universities that are willing to fight for our community is amazing.
This is not a throwaway city. These are not throwaway kids. And if there was ever a time to invest in our children, it is these children, and it is now.
Welcome back. We're here with Dr. Lawrence Reynolds, president of the Mott Children's Health Center here in Flint, Michigan. Dr. Reynolds, you not only work in Flint, live in Flint, part of this community, but you were actually appointed to the Water Commission by Governor Snyder when this finally got the media attention that it deserved. Tell us about your role there.
Well, I was part of a group of 5, a commission of 5, and we looked at all the issues that were related to how the Flint water disaster developed. And it was a continual failure of the executive branch, the governor's office, the Michigan Department of Environmental Quality, and the Michigan Department of Health and Human Services to respond and properly monitor water quality. And perhaps even worse, when city water plant operators said, we're not ready to make this change. And if I had my choice, it would not happen. No one put the stops on it. And so it was a continual failure. It was a dismissive attitude toward the complaints of citizens. I'll tell you this, it was so egregious that in the first month of our investigations, we couldn't figure out why this even happened. How could this happen in the United States in the 20th century? In 21st century. In the 3rd month of deliberations, we had a lull in the conversations, and one of our members asked, are any of you guys waking up at 3 in the morning thinking about this? We all raised our hands. And these were people from all over the state, different political parties. It was so egregious that it would wake you up out of your sleep. So we shared the trauma of what happened. I'm not quite sure the executive branch really understands that.
Maybe they understand but have a different agenda.
Well, if you acknowledge the problem, you have to accept accountability for the problem. You have to adequately fund it. And yes, you are open to legal action, including possible criminal action. And we've all seen this play out in the press, although it's agonizingly slow. And we've watched they've attacked low-level people, and hopefully the investigation will persist.
Well, our politics and the way that we handle these kinds of things now have a pattern, a repetitiveness, where those are the only people that get accused of anything, the ones who basically take the blame for everybody else. They're the only ones that stick when you throw it all up against the wall. And as a result, enough time goes along and the general population in the community feels that this is the best that can be done under the circumstances, which is furthest from the truth. We have another issue here, and just instead of the pediatric focus on lead poisoning, the adult focus on lead poisoning. We know as physicians that lead damages renal bed tubules, okay?
Oh, yes.
And that a lot of folks for years have looked at how we improve kidney function when we can remove lead through various means, chelation medications, okay? But African Americans that I treat who have not had adequate access to the healthcare system walk in stage 3 kidney disease already, have high blood pressure, diabetes, hyperlipidemia on top of it. It doesn't take much to push them into renal failure, which means that we should be seeing, if the predictors, God forbid, are correct, we're going to see more renal failure in the senior citizen population in Flint, Michigan, who've ingested the water.
Without a doubt. See, once again, you've reminded me that I'm a senior citizen as well as a pediatrician. And so, yes, there's hypertension, gout, stroke, obesity, diabetes. All these things are related to lead, and we have not removed, as you have said, the source of that lead. Now, there are treatments that we have used for people occupationally exposed. One is called chelation. This is a chemical that binds these poisonous heavy metals. We've used it for blood levels above 40, but now we need to seriously look at, is this appropriate for low-level lead exposure? We also have to determine what is the body burden of lead, and there are some experimental techniques to measure this. But we have to move beyond just waiting for someone to present to a dialysis unit and focus on, okay, how are we really going to treat low-level lead exposure?
Dr. Reynolds, what is your hope? I know you're very passionate about this. What is your hope for the city of Flint?
My hope is, number one, that the water system will be replaced. And if I can digress, when this jumped off in January with the governor's commission, people from the Netherlands came and talked about how they rebuilt their water distribution system in Amsterdam. And I asked them, why did you all come here to Flint? And this gets pretty emotional. They said, because Flint built the bombers and tanks that liberated our country in World War II. So we got more compassion and action from people from overseas, the Netherlands, than we got from Lansing, right in our own state. So my hope is that people who have that sense of justice, compassion, will act. Then realistically, revenue sharing has been cut, and that needs to be restored. The governor's emergency managers are the ones who cut the budgets, who impaired city functioning, and did not address any ongoing maintenance issues. And those funds have to be restored so that we can rebuild our cities. And I'm not saying inner city, because that seems to be a tagline for black communities in a city. I'm talking about our entire cities. Because yes, Flint is 60% black, but it's also 40% white, well, even 5% Hispanic. And we have all been affected. And the most egregious thing is you can go to one side of the street on our border outside, there is no problem. And on the other side of the street, there is a problem. And in the United States of America, that should not be tolerated.
Dr. Reynolds, this has been the best wake-up call since the crisis. Thank you for your dedication, your work, your compassion to this whole issue. And we know that with people like you here in Flint that things are going to not just get better, this is going to get resolved. Thank you so much for joining us on Primary Care.
Thank you, Dr. Joe.
We've been talking with Dr. Lawrence Reynolds, President and CEO of the Mott Children's Center here in Flint, Michigan. The water crisis in Flint poisoned the drinking water of an entire city, but it's the children who will be most affected. Lead exposure causes cognitive and behavioral problems like delayed mental development, aggression, irritability, and learning problems. And we cannot ignore the presence of racial and social injustices in this public health crisis. It will take a collaboration effort from the public and the private sector working with the residents of the city of Flint to rectify and overcome this atrocity. But it must be done, not only for ourselves, but most importantly, for the children. I'm Dr. Lonnie Joe. Thank you for joining us on Primary Care. You can get more information about the show and our guests at primarycare-tv.com and continue the conversation on Facebook and Twitter.